Welcome to the Dr. Carolyn Coker-Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker-Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Welcome to the Vital Life Radio. I'm your host, Dr. Carolyn Coker-Ross, and today my guest is Dr. Decker Weiss. Let me tell you a little bit about Dr. Weiss. He is the first naturopathic physician to complete a residency program in the Columbia Hospital System, the Arizona Heart Hospital, and the prestigious Arizona Heart Institute. He's also the first naturopathic physician to be on staff at a conventional hospital, which is the Arizona Heart Hospital. He's assistant professor of medicine at the Southwest College of Naturopathic Medicine, and he has a private practice in Scottsdale, Arizona. So Dr. Weiss is a heart specialist or cardiologist, and today we're going to be talking about stopping or reversing heart disease naturally. Welcome to the show, Dr. Weiss.
Oh, thank you for having me on.
Yeah. So first of all, I just wanted to, if you don't mind, I don't know if all of my listeners know why it is so significant that you're the first naturopathic physician to do all of these things. Can you just say a little bit about your training and
Sure.
how it's a little different from conventional medicine?
Yeah, a lot of the physicians that are into natural medicine, especially cardiologists, in fact, all of them were conventional cardiologists first, and then later decided, maybe there's something to these natural things, and they either start using supplements or taking courses, but they're medical doctors by training. It's very different where I'm a naturopathic physician by training. I went to a naturopathic medical school in Tempe, Arizona, and after I got my bachelor's degree, I went to medical school, but it was a naturopathic medical school. And then with that credential, I went into a conventional system, which is very odd. Usually conventional schools will lead into conventional residencies and fellowships.
It's not common for a conventional medical school or a conventional residency to host a naturopathic physician. Your training is very similar to ours, from what I understand, except that you have much, much more training in the natural therapies, herbal remedies.
There's also a philosophical difference where I think that I would argue that allopathy isn't such a philosophy, and with a lot of my conventional colleagues, isn't such a strong thing. They don't wake up today and say, today I'm an allopath, and today I'm going to work against disease. And it seems like a lot of my conventional colleagues don't need to define their philosophy. Naturopaths, we're phobic about not defining our philosophy. We are always defining our philosophy. The body, when unobstructed, can heal itself, removing obstacles to health, restoring, not replacing, these types of concepts. So we get very married to our philosophies, and we try and not make it so much about the therapy, but more about trying to get the body to repair itself and do what we want it to do.
Yeah, in my training, I did a 2-year fellowship with Dr. Andrew Weil's program in Tucson, which is integrative medicine, and we start with that same philosophy that the body has the power to be self-healing. So anyway, I just wanted to kind of give people a little bit of an understanding that there is a different philosophical approach, because I think it's important when we start to talk about your approach to heart disease, your philosophy and your understanding of the causes of heart disease are very different, I think, than what conventional medicine is pursuing. So can you tell us a little bit about that?
Yeah, and I think for the record, we're a little more outegrative than integrative. I've always wondered why Dr. Weil called this problem integrative when you have these smart physicians trying to figure out how to get people well and stay out of the system. And that's largely what I'm also doing. In essence, the fundamental difference is that we're looking at the underlying causes of heart disease and directly applying natural models to resolve them. cardiologists tend to be after-the-fact types of practitioners. You have an 80% blockage. You have a positive stress test. You've had a heart attack. A lot of the studies are what we call secondary prevention studies, where after you've had a heart attack, we've tried these things in order to prevent you from having another one. Naturopathic physicians are what are the underlying causes. And the illusion there, doctor, is that well, once you've had stents and bypass, then you really just need to stay in these conventional systems because you're always going to have just problems with them. But really, these underlying causes become much more important after you've had a heart attack and after you've had it. I had a new record. I had 4 patients yesterday with a combined total of 36 stents, of which 30 of them were occluded. So for those folks, I have the same exact talk as I have, well, with some differences, but almost the same exact talk as I have with somebody who just wants to prevent the disease. Oxidation, inflammation, nutrient depletion, toxicity, hormones, and mind-body are the underlying causes of all heart problems and most cancer problems, actually.
And most chronic disease problems in general. Yeah. Well, let's get into that a little bit more because, in my training in conventional medicine, we look at prevention, but obviously it's not a big focus. Unfortunately, my residency training is in preventive medicine, but I think generally you're right that we're treating more symptoms instead of underlying causes. But there is a theory in medicine that, if you can lower your bad cholesterol, if you can increase your good cholesterol, then that's the main reason. That's the main thing that needs to be treated.
Which isn't working.
You say no, and tell us why.
Well, lowering cholesterol, this isn't our first go-around. And I always include myself in the family of all physicians. Some people naturopaths shouldn't be. I don't get into that. To me, all of us are, anybody who sees patients is a doctor to me. So you got patients across from you get my respect. That's the way I look at it. But when you look at lowering cholesterol. The first time it was done is in the 50s and 60s in Scandinavia, and they started to run some data on that. And the only thing they really found out is they created a lot of depression. And then we tried it again when statin models came around, when the red yeast plants, red yeast rice they were finding these statins like lovastatin and fluvastatin and simvastatin and pravastatin. These things would lower LDL and sometimes raise HDL and sometimes affect triglycerides. And they found, hey, look, we can change the numbers and prevent the disease, but it really has been, largely a lot of hype, largely a lot of people trying their best. Medical doctors, like naturopaths, love to see labs change, and then we love to look at patients and go, see, this lab is better, your heart is better, but it doesn't simply work with it. Here's the problem. Cholesterol is in every cell in the body, and when you look at longevity, it used to be associated with higher cholesterols, which actually makes sense. Probably better brain function, healthier hormone production. Cholesterol is the duct tape of the human body. It basically
so you're saying you're saying in the past having a higher cholesterol was a good thing?
Yes, it still is.
Okay.
And it still is when we look at the Inuit studies done in Greenland, where 300 and 400 LDLs. But a couple things came out. One is their DHA to arachidonic acid levels were like 3,000 to 1. Translated, good fats are good for your body. Bad fats are really, really bad for your body. There is nothing in the middle. The other thing is oxidation. For those folks that have higher LDLs, you have more cholesterol that can oxidize. LDL, when rancid or oxidized, attracts the immune system and then develops the disease. Medical doctors decided we're going to interrupt the part of LDL production in order to try and halt or slow the progression or reverse the disease. The problem with that is LDL is needed for everything. It makes hormones. It's in brain tissue. And when you start lowering it, you get an unpredictable cascade. We think statins cause cancer because in animal studies they always have. We also I think they cause heart failure, and now there's more and more studies about linking lowering cholesterol with lowering ubiquinol and CoQ10 levels and triggering heart failure.
Okay, well, I want to slow us down a little bit because not everybody probably understands all the terminology that you've used. Mm-hmm. So let's go back when you mentioned the Inuit studies and talking about the ratio of DHA to arachidonic acid, and what we're talking about is the ratio really of omega-3 fatty acids to the omega-6 fatty acids. And the omega-3s are anti-inflammatory and omega-6s are pro-inflammatory. And that's what you're saying is the problem. If we have too many of the wrong kind of fats, right, then we would have this inflammation and also oxidation. Did I get all that right?
Well, close.
Okay.
You get the inflammation. You know, poor sources of beef, for example, are very high in the inflammatory types of omega-6s that you were saying, the arachidonic acid. When they went away from eating seal and fish every day and went to beef, that completely flipped their nature, and they weren't ready. But the other thing is they brought in sugar and alcohol, which now with all that cholesterol, they had a lot more opportunity to oxidize cholesterol, and they went into rapid disease states. And so it's a combination of oxidation and inflammation that brews the disease. And that's what they went from simply, you know, going out to their hut and eating native food. When they walked into a Burger King and started to eat, that completely flipped it, and they got rapid disease. What higher and you know, naturopaths and other practitioners of natural medicine try and interrupt the disease by blocking the oxidation of cholesterol. When those Inuits come into my office, or those Scandinavian genes or the Milan genes with 200 LDLs, I put them on a lot of antioxidants. It is agreed in all systems that it is the oxidative stress to the cholesterol, the oxidation of cholesterol, that causes the disease. But medical doctors, for the most part, do not believe you can prevent that with antioxidants. We believe that you can. And so, you know, this is where a lot of Mediterranean diet with food with high in antioxidants and good anti-inflammatory oils. Years ago, there was the Lyon Diet Heart Health Study that was dramatic, along with Framingham, showing the changes when you get the beneficial fats and the high levels of antioxidants in foods, as well as, you know, that. I strongly believe...
Let me just interrupt here. So if people are wondering, like, how do I slow down oxidation? You mentioned diet. So the Mediterranean diet is high in fruits and vegetables, olive oil. What are some of the other dietary components that people need to slow down this oxidation cascade?
You know, berries, bright-colored berries, the purples, the reds, the blues, all of those types of things, all those strong antioxidants, as well as the freshness of foods, which is why Europe has such a huge advantage. We're very industrialized foods here, as well as now really keeping the grains, all grains, breads and things to a minimum. But there simply isn't enough antioxidants in food to solve it. Okay. At the end of the day, you're going to have to supplement to prevent disease.
So you mentioned supplementing with omega-3s or other healthy fats. Are there other supplements? Because there has been some controversy in the research about, for example, taking vitamin E supplements.
Yeah, here's the thing. I can write a study I know will fail, and that's what I think happened with those studies. You know, vitamin E in the Cambridge Heart Antioxidant Study, you know, simply was a star. And then you get into pharmaceutical models and you get into all those controversies, and all of a sudden it's good, bad, good, bad. Here's what you have. Vitamin E is a category. It's not a single entity, similar to vitamin D. Now, everybody's talking, is it D or D3? And then vitamin E is good, vitamin E is bad. The problem is that with vitamin E, you need the gamma-tocopherols, the gamma-tocotrienols, you need the gamma, you know, the alphas, the betas, and then D needs to be taken with D3. Where we make a mistake is when we start to treat antioxidants like drugs. Okay, it's all vitamin D today. Okay, and vitamin E is bad. And then, okay, it's all vitamin E, but only gamma-tocopherol. What you need is a collection, and the reason is very simple. To the listeners, there's a lot of things that can oxidize your body, and some will help help block it. Some vitamin E thing. Some vitamin E will block some types of free radicals and oxidation, and some vitamin D will help protect others. You need a variety, and these fat-soluble antioxidants that protect our cholesterol, you need to take a collection of them. There's a product out that now has tocopherols, tocotrienols, DD3, KK2, A and beta carotene, with the most important of them, the alpha-lipoic acid, all in one. And all-in-one antioxidants, you're going to see a lot of them coming out are the smartest way. But sure, I can write a study that'll make vitamin E look bad because just taking D-alpha tocopherol is not good for you. You got to take them in collection.
My guest today is Dr. Decker Weiss, and he is a naturopathic physician who is in private practice in Scottsdale, Arizona. He's one of the first naturopathic physician to be chosen as a fellow of the American Society of Angiology, a pioneer in the application of effective natural alternatives to cardiac bypass and angioplasty. And he's helped thousands of patients with his definitive holistic approach to heart disease management. So before we went to the break, Dr. Weiss, we were talking about the use of antioxidant vitamins as a way to reduce oxidation, and you advised that we should, it sounds like you're advising that we should take whole vitamins. For example, you mentioned vitamin E and taking a preparation that had mixed tocopherols and taking vitamin D2 with vitamin D3. Are there other things that people can do to naturally reduce the oxidation risk?
Yeah, what you do is basically everything in your life. When you're looking at trying to prevent oxidation, you really can't. You sort of have to, on every front you can, try and back it off. For example, the soap you use in your house. Do you use a naturally based one or a chemical-based one? Sun exposure, how much of that you get, how you even clean the interiors of your car, how if you have carpet versus tile, all of these things add up. Do you use a natural company to keep the bugs out of your house, or do you spray with chemical pesticides? Along with your food choices, largely the more preserved and the more industrialized your food is, the more potential oxidation it can cause. Simple choices between margarine and butter. Butter is simply better for you. Healthier oils versus using like a canola oil, using a good olive oil. It's an ongoing battle, and a lot of people get very frustrated with that because they try so hard. Please understand, all we can do is the best we can each day because there's just so many chemicals and bad things out there for us. It's very difficult.
And what about stress management or practices such as meditation? Have there been any studies to show that they reduce oxidation?
I don't know of studies showing specifically oxidation. What we do have are studies showing prayer, meditation, exercise, the getting sedentary behavior out of your life and keeping moving absolutely benefits heart and vascular health. I don't know specifically of studies talking about oxidation in meditation, but it would make sense simply because one of the ways that we alkalize our body and neutralize things is through deep breathing. And a lot of meditation has these deep breathing techniques and mindful breathing techniques that are probably beneficial. So while I don't know of studies, I sure recommend it.
Yeah. Well, there actually are studies on types of exercise like yoga that involve deep breathing that show that it helps with insulin resistance and glucose tolerance, and so that I think those studies are beginning. I wanted to go into, so we've talked a little bit about cholesterol and that it, from your point of view, is not the end-all, be-all of heart disease prevention. But there are other risk factors such as high blood pressure. How do you deal with that naturally?
Well, high blood pressure is the result of ongoing problems. High blood pressure is a sign that the endothelium and the immediate layers of blood vessels either don't have the proper nutrients, are being exposed to oxidation and inflammation. Kind of like hypertension is sort of your goggles to see the iceberg. Okay, and it's letting you know that your vascular system is having issues. And hypertension comes down when you solve those underlying issues. For example, magnesium deficiency is a very common reason why people have high blood pressure, but it takes a while to replace magnesium. It takes about 6 months to 2 years of oral supplementation of even a good magnesium in order to fix that. Hypertension is a little trickier because if you just leave it high, you can damage your vascular system while you're working on the underlying cause. So whether we do it herbally with under pressure or things like that, or we do it with drugs, we do need that pressure and range while we're working on the heart, and sometimes it'll involve medication.
Okay, so under pressure, is that a supplement?
It's an herbal formula in some of the stores now.
Okay. Besides magnesium, are there other things? I know exercise is something, but are there other supplements that can help with high blood pressure?
Well, there are, and you usually look at vascular support versus some things that are like vasodilators, like herbs like Rauwolfia and Kella are vasodilators and actually work a little more like how medications will, versus using things like Indian Gooseberry or Amla to help heal the endothelium and the media layers and block that inflammation where it's attacking the vasculature as an underlying cause. It gets kind of complex with high blood pressure, but for most people, we just need to keep it in range while we're working on the underlying causes.
And you also, I saw in an article you wrote, recommend Indian Gooseberry for heart disease.
Yeah, I use a lot of it. Indian Gooseberry, it's similar to hawthorn where it has a strong affinity for the intimal linings of blood vessels. And it seems to be anti-inflammatory and a strong antioxidant for those layers, helping heal and repair. In essence, heart disease is endothelial dysfunction, meaning the linings of your vessels. The endothelium is the largest organ in your body. And when that doesn't work right, it can tend to rupture or tear, which causes a heart attack. So what we're looking at with blood pressure, or when we're looking at with, the Indian Gooseberry, is there's absolutely no doubt of the affinity for reversing small 20-30% blockages between these endothelium and media layers, these things that cause heart attacks, that Indian Gooseberry can help reverse that in the presence of antioxidants and these other things. It's really the breakthrough we've been looking for.
What about curcumin as a supplement for heart disease?
I don't use curcumin specifically for heart disease. Mm-hmm. What I use curcumin is, you see, inflammation is tricky, and it's hard for consumers to understand and the average person to understand what we're talking about. When we're saying inflammation, we're not talking about a thumb in a car door swelling. What we're talking about is chronic stuff. And for everybody, it's an individual. For example, when my patients come in, do you have digestive problems? Do you have joint pain? Do you have irritable bowel or Crohn's? Do you have chronic skin problems? How are your teeth and gums? Do you have estrogen dominance? These are the things you have to find out specifically because these are the sources of chronic inflammation. When you're looking at joint pain or fibromyalgia, curcumin with phenylalanine and a lot of these things, this is one of the premier ways to get rid of the pain. See, one of the keys, doctor, here is that when you're looking at prevention of heart attack and secondary prevention, drugs just don't do it well. Mm-hmm. Simply, if you take a Tylenol because you have back pain, Tylenol most likely, with research, will say that it will increase or even double your risk of a heart attack. When you take curcumin and phenylalanine and boswellia and things like that, when you're having back pain, then you probably haven't increased it and most likely have decreased your risk of heart attack. All you know is your pain is better. But how you go about that is vitally important. And in natural and conventional models of medicine, there are no safe anti-inflammatories. And I know what's coming. Dr. Weiss, my aspirin a day. Well, aspirin a day is very, very controversial. For every aspirin you take, you bleed about a teaspoonful of blood. There's nothing natural or protective about that.
But some of the other things that you mentioned, which are in the antioxidant category, are things like green tea and resveratrol.
Yeah.
Are those effective? Is there any evidence to support that they're effective in helping with inflammation and oxidation?
Well, green tea, for sure, more with the oxidation end. It's not as strong a potent of anti-inflammatory. The catechins in green tea, so there's a reason why it's the number 2 consumed liquid in the world, and there's a reason why in areas that are incredibly toxic, China, for example, where they smoke and the air is filthy and the water, that they still have far less cancer than America. There's reasons for that, and those catechins in the green tea are these specific antioxidants. The resveratrol is going to be, along with things like curcumin and Indian gooseberry, it's going to be your anti-aging antioxidant because there's a fat-soluble effect, a water-soluble. But the thing with resveratrol is there's more. There's more benefit than we even know yet. Because resveratrol, like CoQ10, ubiquinol, which is the premier fat-soluble antioxidant for the heart, when you're looking at resveratrol, every time we study it, it's better. Yeah, it simply doesn't. And
resveratrol is what they think is responsible for the French paradox, that the French people can eat so many different fatty foods, and yet they have a lower risk of heart disease than America, right?
Yeah, but that's not accepted. The French paradox is minerals. I've been in France, and I've lectured in France, and I've met with the health ministers. And
but the resveratrol comes from red wine, right? And they think that there is some thought that drinking red wine has in small amounts has a beneficial effect on the heart, correct?
Yeah, there's some thought. Here's the thing with red wine. We are a lousy population at relaxing. Red wine is one of the safest ways to relax. It has a little antioxidant in it, like resveratrol and paranthocyanidins. It's relaxing. It's frankly, red wine is safer than Coca-Cola, in my opinion, especially Diet Coca-Cola. So
I'll agree with you there.
Yeah, and so when you're looking at habits, I will never conclude that, red wine is good for people. Alcohol is still a toxin to the heart, the ethanol. Well, this has been accepted forever. But in little amounts and, occasional stuff, and especially higher quality red wines, it's going to be safer and people will live longer just because they probably sleep a little better and they relax a little bit better. And if somebody said to me, Dr. Weiss, hey, should I take a sleeping pill or have a glass of wine? I'm going to say have a glass of wine.
My guest today is Dr. Decker Weiss, and he is a consulting physician at the Arizona Heart Hospital. He's a cardiologist and has a busy practice in Scottsdale. And today we're talking about how to stop or reverse heart disease. So, Dr. Weiss, I want to talk a little bit more about diet. And as you know, having salt is a big issue in diet recommendations from physicians now who are saying that particularly if you have heart disease or heart failure, you should be on a very low salt diet. Do you have any position on that?
Yeah, the first thing I have to say is if the low-fat, low-salt diet from the American Heart Association, which started like 20 years ago, would have worked, we wouldn't be talking about this today.
That's
okay?
for sure.
The number one, okay?
Yeah.
So number two is what we're doing is we keep turning our foods into drugs, and we need to stop that. Now, for salt-sensitive people, if you have heart failure or kidney problems, you have to watch the salt. For the other 99% of us, it's the type of salt. Salt is ideally a collection of minerals, and it's not white. Salt should be a brown color or a gray color. When you evaporate, for example, seawater, you get a grayish mix of minerals dominated by sodium, but with magnesium and various other trace minerals in there. Similar to humans are the same thing. We need some sodium, especially I'm out in Arizona. We need sodium, but we need all of these other minerals all the time.
So what's the best salt to use?
Well, there's several of them. There's a real one called real salt in the stores. There's one that's a Himalayan salt. I'm married to a European. We have 8 kinds of salt depending on how she's cooking, none of which is white. The key is that the salt is not white. Salt became what we call unopposed sodium chloride, where it was only sodium chloride, and we became sodium chloride toxic. Symptoms of that are high blood pressure and holding fluid. When you eat a healthy salt, it's good for you. It is a
okay. What about the iodine in salt? Is that in the other forms of salt?
Yes, it is, especially in good sea salts. Iodine is a necessary part of salt, and in the sea salts you will get a good amount of iodine in there, and we will start people on it. We are deficient as a community in the United States in iodine because when we took unopposed sodium chloride from a mine and then we iodized it, it wasn't enough. So the Morton salts that you hear about, and they're iodized, we thought, okay, humans need iodine, there's no more goiters and things. It simply isn't working. We need more iodine in that. Ask any estrogen-dominant woman whether they should have iodine or not and how they feel if they can take it safely, and they'll tell you they need it. And
are you talking about iodine as a supplement or just getting iodine in your salt?
Both. Sometimes you need to supplement it in order to get your stores back up, to get well, to support your thyroid and things. Not if you have an allergy, but but the way to start is always by changing your salt over and getting trace amounts all the time. That's how the body likes to get minerals. It likes to get little bits all the time of minerals. And we give them in these big chunks, and that's needed sometimes, but it's not preferable.
Okay, what about meat in the diet? Because meat is a kind of not exactly anti-inflammatory. So some of the anti-inflammatory recommendations are to eat more fish and vegetarian sources of protein, but meat also has amino acids that are healthy for us. So how does that affect our health, our heart health?
Meat is always going to be controversial. The best diet in the world is the raw vegan diet, which is hard and it's not for everybody. The reality is, as physicians, if we say, okay, everybody should be a raw vegan, you're not going to get very far. All meat and fish to a degree can be, flesh proteins can be inflammatory. The ones that lean towards not being anti-inflammatory, for example, are salmon. But we're going to treat it like salt. All beef isn't created equally. You've got organic, free-range beef where they ate grasses. The fat contents, remember about 1,000 years ago we were talking about arachidonic acid and things like that? The fat types in the meat are going to be much better if they are eating grasses and free-range versus something that is a factory farm-fed corn, which to me is very dangerous for our diet. Literally,
and I understand that beef that's free-range also has a higher omega-3 ratio too.
Yeah, a lot of these people who live 100 are these farmers, and you ask them, did you eat meat? And they said, well, I ate my meat. I ate the cows that were in the pasture, not the ones that we sent off to slaughter. And you'll hear that all the time from them. And also for you hunters out there, there's a significant, elk and buffalo and deer, these meats have way more benefit, a tremendous amount of benefit. And in a balanced
we're
diet,
pretty lucky in Colorado that we have a lot of game meats, buffalo and elk in particular. I want to go into some specifics now, Dr. Weiss, and just ask you, what is your approach to someone who may have already had a heart attack, who would come into your office and say, well, I'd like to see if I can reverse my heart disease. I know that Dean Ornish's studies have shown that the very, restrictive diet that he promotes has been able to, with proof, reverse heart disease, that kind of vegan diet. But what are the other things that you would recommend to people coming in who've already had a heart attack?
Well, number one, we need to prioritize. And sometimes their priorities are keeping my cholesterol numbers there or whatever, and I say, no, your priority is to not have a heart attack. And believe it or not, doctor, they're all caught up in their labs, and they're not caught up in how they feel and whether their circulation, for if they come in, they're still pale, but their cholesterol is normal. That the first thing we have to do is we have to reestablish and affix the lining, the endothelial lining of the vessels, and stabilize it.
And you're doing that with the Indian Gooseberry?
Indian Gooseberry, hawthorn extracts, antioxidants. It's going to be individualized, but those are some of my most powerful tools. With that, I do an inflammation inventory. Okay, you have heart disease. Where's the inflammation? Is it poor digestion? Is it joints and all that stuff? And then you treat that inflammation naturally, because as the inflammation comes down, the immune system calms down and stops dragging that cholesterol into those vessel beds.
So if they have arthritis along with their heart problem, what would you do differently then?
Well, number one, I'd see what they're doing for their arthritis. So if they're saying, well, I take 3 Tylenol a day for my arthritis, I'll say... Or
they take glucosamine, let's
say.
Bingo.
And so we move them into natural models, and then we put them in an anti-inflammatory diet. Again, a raw vegan diet, but not everybody's ready for that. Salmon twice a week for non-vegans, always, because it lowered risk of heart attack as much as statins. Or more. It's well over 30% reduction in second heart attack and secondary prevention studies. So always salmon twice a week. Explain to them that iceberg lettuce is not a food. Okay, it doesn't belong and should not be called a food, in my opinion. White sugar is not a food. It is a toxin. It doesn't exist in nature. Somehow iceberg lettuce is a living plant, but I don't know how. But you know,
well, it's a good source of water.
Yeah, there you go. So, you know, getting them into that stuff, explaining that there's good fats and bad fats. And then when you're looking at Ornish's stuff, you're talking about mineralization. Then we have them check their pH, their urine and saliva, and I have to get their pH up into the 6s and 7s, which is a whole other probably radio show. But it's about mineral content. It's about the salts, the minerals, the green powders, salads, how you eat, because we have to start moving them to an alkaline body environment, which then degrades the calcium out of their arteries. It's not the vegan diet that pulls the calcium out of the arteries. It is the anti-inflammatory and the fact that we are saturating them with minerals, and then that's what will pull the calcium out. And so you can be flexible with carnivores as well. And I think that's part of what Dean has done is magnificent, but he's excluded too many people. And we need to bring these models to everybody. And when you explain to a carnivore the difference between elk and buffalo versus what's going on at McDonald's, they get it. Yeah. They do real well with it. And then they can embrace it. And as physicians, we've done our job. We've adapted to the patient's needs, but we're getting our medical goals in.
So there are certain types of diets that are more alkaline, too, that would help get your pH levels up, right?
Oh, absolutely. Minerals. And when you were speaking about the French anomaly, minerals are in the water. They are very dense minerals. Their bread is not white, it's gray, because it has minerals.
So what are things that Americans can do to get their minerals up, though?
Well, number one, understanding, and I'm going to pick on iceberg lettuce again, that I don't consider iceberg lettuce a food. You got to go to dark leafy greens. You have to go to cruciferous vegetables. But it's also almost impossible to get minerals strictly from food now, because even organic is still depleted soil. Mm-hmm. Organic is largely what it's not. It's not pesticided. It's not, genetically modified, those things. But it isn't.
So you're talking of really having to take a mineral supplement as well.
What you see, the nice thing is by doing your pH testing, you can find out what you exactly need. So you don't have to over-supplement or under-supplement.
We're back on the Vital Life Radio, and I'm your host, Dr. Carolyn Coker-Ross. My guest today is Dr. Decker Weiss. He's a naturopathic physician who is a consulting doctor at Arizona Heart Hospital and has a busy practice in Scottsdale, Arizona. I want to make sure that we get your website address here because as you mentioned on the break, you have a book, but you're not going to write a second book. But on your website, you're going to put up much of what we've been talking about today on how to stop or reverse heart disease naturally. So the website address is weissnaturalmedicine.com. Apparently it's under construction for the next 2 weeks. Is that right?
Yeah, in within about 2 weeks, we're going to publish, basically if I was going to write a second book, how to reverse heart disease is going to be on there. You don't have to buy anything. It may not be individual enough for you. You may need to have a physician guide you through it, especially if you've already had a heart attack or you're on medications. Then you will need to have a physician guide you through it. But the principle...
So are there other ways to find physicians who have the same kind of background that you do if they wanted to find someone and they aren't in your Scottsdale, Arizona area?
Unfortunately, I'm the only naturopathic cardiologist. We've just trained another one, and we're going to see where she's going to land. She's picking what part of the country. But these days, I think, it's interesting. I mean, a medical doctor like yourself and a naturopath are having more and more in common every day. So, and then I know naturopaths that aren't exactly practicing natural medicine anymore. So I think it's an individual thing. I think if you look at the resources in town, boy, there's some darn good chiropractors out there, too, that know how to do this, because the principles of natural medicine never change, ever. Right. As long as gravity's around, what we're saying will work. We didn't invent it. We're just trying to find better ways to deliver it.
At least in two weeks or so on weissnaturalmedicine.com, WEISS, naturalmedicine.com, there will be more information about what we've been talking about today that Dr. Decker Weiss has told us about. So I just had a few specific questions, if you can give me some quick and dirty answers.
Okay.
Is there any use for statins in the treatment or prevention of heart disease from your point of view?
In my opinion, no, unless you have 4 to 5 uncontrolled risk factors. That supports the science. The science says that if you are a smoker and you are hypertensive and a diabetic and you're overweight or those types of risk factors, that statins, as you get to 4 or 5 risk factors, may give a benefit. So that's what I say. I follow the science. So for those with 4 or 5 risk factors, you may want to consider it.
Do you treat women with heart disease any differently than men?
Yes, I do. And the quick and dirty is, gals, number one, we didn't study you. Arrogant men said that we didn't need to study women and that actually your menstrual cycles got in the way of the research. This is very true.
No, it's true in all areas of research.
You're right. You're right. My apologies. In all areas. And so the things you need to know are threefold. One, you don't present for heart attack like guys do. The chest pain, all that. You can just have odd palpitations. It's just different how you may be sensing that you feel it. If your instinct is something's wrong, get to the hospital. Number 2, roughly before menopause to after menopause, you'll go from 7 to 1 risk to, like us fellas, about 3 to 1. 1 in 3 will get it. So that menopause transition has to be dealt with aggressively as far as antioxidants and balancing hormones. It is such a key time, not just for, feeling good and sexual activity and things, but also for heart and what's going to happen the next second half of your life. The third thing is the big rivers, the big vessels, the left anterior descendings, the right coronaries, they're not as important for you ladies. The micro circulation, the small vessels and capillaries in the heart are much more important, which is why we have better effect with herbs like ginger and cayenne and ginkgo and herbs that can promote circulation to the heart. So when we do things like stent and bypass with you, number one, don't expect a significant result because they don't even tend to work well in men. But in the other side of that, your microcirculation can open up and really do the job quite well. So there's an advantage for you gals.
Are there specific types of omega-3s that you recommend? I mean, some people, I had a guest on who was talking about prostate cancer, and he recommends only salmon oil for omega-3 fatty acids, and other people who've recommended krill oil or flaxseed oil. What is your approach there?
The two I will never use are krill and flax.
Okay. Good. We agree on those.
Okay. For a lot of reasons, including humane reasons, but medically I wouldn't do that. Then the others, the salmons, the ones from anchovies, which is like Nordic Naturals and Eskimo 3 and all that, the problem is our oceans are getting dirtier and more radioactive every day right now. So getting them clean is getting harder and harder. Where I'm moving more is to the tableted fish oils. There's 2 companies making it now. They're the brains of the fish that they process in a way to retain the oil, and they're in a tablet, and it's very absorbable. It's also sustainable, but you don't have to worry about metals because it's in the brains. So for seniors who remember when people used to do fish head soups and eat brains, we're kind of back to that for fish oil.
So what are the 2 companies that make it?
There is one that is starting to make it out of California, and I don't remember the name of the company. The other one is a product is actually designed out of France. The distributor is Europharma USA, and the product is called Vectomega, and that's the main one you'll see around. And it comes with a bunch of research because it was designed for kids with cognitive impairment and hyperactivity in France.
Okay, good. What testing do you recommend for your patients when you're working with them on reversing heart disease?
Yeah, the most important test to run now, oddly enough, is not a stress test, because stress tests show 70-80% blockages. They don't show the ones that cause heart attacks to 20 or 30%. To me, the most important tests are, number 1, what's called an IMT. It's an intimal media thickness test that also shows small and mixed types of plaques or blockages. And it's actually a carotid vessel test, no needles and no radiation. It's kind of nice. Mm-hmm. And it will tend to show if you've got these risky type blockages. The next test I would really like is these ones for endothelial dysfunction. It's called an endopath, and insurance is covering them now. Medicare's covering them.
Are they done in the office?
Done in the office. We do them here in our office. It's not widely used yet, but it's spreading all across the country now. Because if your endothelium is not functioning properly, you're very vulnerable for heart attack. And then the third one would be a resting ultrasound of your heart to look at the vessel, to look at the valves, to look at the size of the heart, to see if you had an old heart attack. And then after that, of course, a stress test, but I don't recommend nuclear stress tests, especially for women.
Well, I have to interrupt you because I'm sorry to say that's all the time we have today.
Oh,
I'm going to probably call you to come back on the show because this was a great show and way too much information to cover in just 1 hour. But I wanted to thank you, Dr. Weiss, for taking the time to be on the show, taking the time away from your busy practice to be with us today and to talk about reversing heart disease naturally. So I appreciate it.
Well, thank you, and it's nice always to talk to a colleague.
Yeah, and I wanted to let everyone who's listening know that our show next week will be with Rob Weiss, and he is a specialist in sex addiction treatment, the founder of the Sexual Recovery Institute, and he'll be talking about sex and addiction in the digital age. I'm your host, Dr. Carolyn Coker-Ross. I encourage you again to check us out on iTunes and to sign up for my newsletter at www.carolynrossmd.com. Until next week, I wish you good health and vitality.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit carolynrossmd.com. That's carolynrossmd.com to access podcasts, show archives, and more about Dr. Ross and her services.